Rogini College of Engineering and Technology. I am Boyke Selvi, Assistant Professor, Department of Physics, Rogini College of Engineering and Technology. In this video lecture, I am going to explain biological effects of dosimetry. Dosimetry is a measurement of radiation dose absorbed by biological tissues. The biological effects of radiation depends on the dose, dose rate, radiation type and tissue sensitivity. Understanding these effects is crucial for radiation therapy, radiation protection and space radiation research. Types of biological effects of radiation. Deterministic effect occurs when radiation dose exceeds a threshold. The severity increases with dose. Common in high dose exposures such as radiation accidents or radiotherapy. Examples: skin burns, cataracts, radiation sickness, sterility. Stochastic effect. No minimum dose threshold. Any dose can increase risk. Probability of occurrences increases with dose, but severity is independent of dose. Main concern in low dose radiation exposure, example medical imaging, environmental exposure, example cancer induction, genetic mutations, long term cardiovascular diseases. Dose dependent biological responses. Low doses less than zero point 0.1 gray, minimal immediate biological damage. DNA repair mechanism usually correct damage. Risk of stochastic effect, example cancer, increases over time. Used in diagnostic imaging, X-rays, CT scan, PET scan. Moderate doses 0.1 to 1 gray. Cellular damage increases, but most cells survive. Risk of cancer and genetic mutation rises, can cause temporary bone marrow suppressions. High doses 1 to 10 gray, significant tissue damage and cell death. Symptoms of acute radiation syndrome appear: nausea, vomiting, and fatigue. Used in radiation therapy requiring fractionation to minimize normal tissue damage. Very high doses, greater than 10 gray, severe and often fatal radiation injuries. Whole body doses greater than 6 gray without treatment for lethal. Hematopoietic syndrome, gastrointestinal syndrome, and neurological syndrome occurs at extreme doses. Radiation effects at the cellular level. DNA damage and repair. Ionizing radiation interact with DNA, causing single strand breaks, usually repairable. Double strand breaks more severe, leading to mutations, apoptosis, and carcinogenesis. Cell fatigue after radiation exposure. Successful repair, cell surveys normally, mutation, potential cancer indication. Apoptosis prevents proliferation of damaged cell. Necrosis, uncontrolled cell death leading to tissue damage. Factors influencing radiation effects. Radiation type. High LET radiation, that is alpha particles, neutrons, heavy ions. This cause more damaging due to the dense ionization. Low LET radiation, that is X-rays, gamma rays, beta particles, less damaging but can still induce long-term effects. Dose rate. High dose rates, more severe effects due to overwhelming repair mechanism. Low dose rates allows for better cellular repair, reducing deterministic effect. Tissue sensitivity. Rapidly dividing cells, that is bone marrow, intestines, skin, reproductive cells, are more radiosensitive. Non-dividing cells, neurons, muscle cells are radioresistant. Application of dosimetry in radiation protection and medicine. Radiation therapy optimizes tumor control while minimizing normal tissue damage. Uses fractionated doses to allow healthy tissue recovery. Medical imaging safety ensures minimally invasive radiation exposure in X rays, CT scan, and nuclear medicine. Nuclear industry and space radiation protection. Dosimeter owned by workers, astronauts to monitor exposure. Epidemiological studies used in research on cancer risk in radiation exposed populations. Thank you.